Hi everyone, Josh Vanna here. Hope you guys are having a fantastic day. Welcome back to my channel. So it's been 1 year since I've been a nurse. Scratch that. It's been 1 year since I've been licensed. I didn't go run after a job real quick after I graduated. I was just like, ooh. But I'm gonna wait for my gut job. When I took the NCLEX, it took me 3.5 hours. I had 75 questions, and the majority of them were select all that apply. So when I left, I was just like, oh my God. Like, I don't even know what's going on. Like, it was just so hard. And it was, oh my God. I hated maternity in school. I hate having 2 patients for the price of 1. I hate L&D. Like, that's my kryptonite. So guess what my NCLEX had a lot of questions about? Maternity, and Picticin, and FSH, and I'm just like, bleh! So I hated it. So I left, and then I didn't think I was gonna pass, and I passed. I got this weird pop-up. It wasn't the good pop-up, but it wasn't a bad pop-up. It was just like some off pop-up. So I'm like messaging everybody, oh my God, I got this pop-up, but I don't know what it is. And everyone's like, ooh, that's not the one I got. And I'm like, okay, well that's not helpful to me at all. And then I checked the website, and it said passed. I'll put a little thing here. And I was just so proud of myself, and like it was like so surreal because I'd worked so hard. Like I have learning disabilities, so like sitting there and concentrating is really difficult for me. So it was really hard, and like it made me take a break because I was in there for more than 2 hours. So I went outside, I was like doing push-ups and crunches and jumping jacks and acting a fool in the freaking hallway. But it gave me enough time to get rid of that anxious energy. I think I did 5 more questions and it cut off. There are some hospitals that are kind of predatory to nurses, especially new nurses, where they offer this really amazing sign-on bonus. I said come in. Zoop. To get my reference. They would do this stuff, and I saw it happen to a couple of my friends. They were just stuck. They're stuck there and they can't get out because the bonus was so high they can't pay it back. Because when you actually get it, it's not the real amount, it's all taxed. Pay your taxes, boo-boo. They catch them and then you're stuck. So that's one thing you gotta watch out for, is read the fine print. I didn't run away and run around and like go find a job. Like I wasn't a server, I wasn't a stay-at-home mom, and I'm not talking down or any of that. I'm just like, well, I have an okay job. I don't need to really go look for anything right now. I can take my time and not accept a position where they're like predatory on nurses. There are places like that, but you gotta watch out for. And one of my friends, he got me into the OR where he was working, and everyone's like, oh wow, an OR, that's intense. But at the same time, I was like, I had a lot of people that I felt were pressuring me to like, hey, you need to do this fancy nurse job. Like, you need to have a cool nurse job. You don't want to be bedside. And I'm like, I know I don't want to be bedside, but I have to do it for what I want to be. I want to be a nurse informaticist. I think that would be super fun. But you have to have bedside nursing care. So like I went to the OR, I started there. It was not what I thought it was gonna be. My first preceptorship was in the ED. That was so fun to me. It was like boot camp. I did like so many IVs. I did so many quick assessments. I think they call them fast assessments. I had like amazing preceptors. They offered me a job as a student, but I was really nervous because I was like, I don't feel confident in my nursing skills yet. I feel like I'm not ready. So I declined. So then I started the OR, and that was a mess. And then they're like, well, this isn't the job for you, but we don't want to lose you to our family. We have you like 3 other jobs that we've set up with you. One of them doesn't even need an interview. You just kind of walk on in. And I was like, maybe not. So I did a preceptorship, or like a rotation in nursing school at my current job. And it was really fun for me. Like it was like, I don't know, like it was nursing, but at the same time you were making people better. Good thing about nursing that I've noticed, going back to before when I was talking about the OR, is like I only have to work 3 days in a row, and I got all the money I need. I mean, I could probably get away with it 2 days in a row, but that's it. I don't have to worry about it. The 4th day, like when you come down and all your like dopamine gets dumped, or your serotonin gets dumped, like the day after that kind of stuff. But like right now, I work in a couple hours. I went to sleep early, so I'm fine. I just have to like take a nap a little bit. Don't even like I have time to do things during the day. I don't have to really schedule anything like all crazy, trying to get somewhere on a Saturday. So that's really good. So I used to work in the OR, right? And in the OR, we would do Monday through Friday. Be there at 6 and whenever everyone's done, you go home. So I never stayed past like 3 or 4. And then some days we'd just be flexed, and I never got like a full like shift or a full paycheck. In the rehab I work at, I'm always there 3 days a week, 12-hour shifts. If I want extra, we can. They used to do sick bonuses, but something happened, so they don't do that anymore. But that was sick. You could get sick bonuses for just like coming into work. So that's another thing, like just the money that you can make is like pretty good once you actually get out there and know what you're doing. I feel like the majority of what I do now is a lot of communicating, be it with my patient, be it with my doctors, be it with my other nurses, or just like communicating with my friends. Because when school started, I cut out a lot of the BS. I didn't go partying all the time. At my age, I really shouldn't be, because I'm like over 30. It looks really weird when I'm out and about in public in like a bar or like a club. It's just like, look at all of these toddlers. They are all getting really drunk. Keeping those contacts with your friends is really good. I made a lot of really cool friends in my career, but I don't know, like the thing is like whenever you're like orienting with somebody, it used to be like nurses eat their young. So I don't act like that. I'm like, okay, if you're gonna be on my shift, I wanna make sure I treat you right and I train you right. Because if I train you right, I don't have to worry about you. But one thing I am good at is being an educator. I like to educate my patients. One thing I like to do is educate my techs, because I feel like that's the only thing that's keeping us separate, because I rely on a lot of my techs because of their experience. Especially when I first started, like coming from the OR where you don't even take vital signs to a place where you're an actual nurse. So like when I first started, people would be like, hey, so blood pressure is kind of high on this one. I'm like, okay, well, what is it? 160? Oh, okay. And they had a stroke. They had a stroke. Permissive hypertension. But then they're like, yeah, but it was a bleeding one, right? Because they've told me before there's a difference. I was like, you know what? That's absolutely right. Hemorrhagic versus ischemic. Okay, maybe it's not permissive hypertension and we need to get them some hydralazine or something. So it's like those little things, putting those little nuances together, like little tiny details about a patient. Like you asked me stuff from the book, I'm like, blah, 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 blah. But then when you asked me to put it holistically together on a patient, I just was having a hard time doing that. Now I'm better. Just experience, I guess. But my techs, they just because they've been doing it so long from what the nurses had told them, like they got it. So I relied on them so much, and I appreciate every single one of you guys. If you're watching, you guys, I love you guys. I guess working with surgery, like surgeons, versus going on to full like physicians, physiatrists. I'm used to an ego that's like, I light the sun. That's the ego that I was used to for the OR. And then I come in and these doctors are asking for what seems like normal stuff. I never talked to a surgeon unless I knew what I was gonna go ask about. So like coming into rehab, everyone seems to be afraid of the doctors. I'm like, here's what's happening. Here's what happened. Okay, so here's the situation. Here's some background on the patient. Here's the assessment. And then here's my recommendation. Easy. I get what I want. Like it's, a few times I haven't, but that's because that they were like, let's be a little more prudent with our use of sleeping pills. And I was like, okay, let's try melatonin. Okay. I don't want to work days because I don't like working with families and try to explain to them what they read on Wikipedia isn't true. You can get hurt by eating too much Tylenol. Like you just can get hurt. So it's like, okay, I don't like working with that. I don't like having to like run around and find patients, because therapy will take your patient for like 4 hours. 6 hours of your 12-hour shift is there with someone else. So you gotta go run around and find them and give them medicine. I don't really care working with the doctors. As long as you tell them what's up, they're not gonna bother you. Management, it's cool. Like it's nice in the day because not only do you have management there, you have resources. At night, you don't have as many resources, so you learn how to get stuff done. We rely on the day people a lot, and I know they rely on us. We used to set everything up so that their day would be good. You would know when someone didn't set someone up right because you'd come in and they'd be all like, Because I stayed extra in school, like here's your lab, guys. You have an 8-hour day. Everyone will book it. Bye, bye. I'm gonna go eat with my friends. And I'd be like, okay, I'm gonna learn how to do trach suction. Anyone staying? And I had my best friend, I don't know, he's like, oh, Siri. So like we would do like trach stuff or like IVs or like, let's do pretending in G-tube. Like stuff like that. That's why I feel like whenever I get introduced to something, I can just do it. Because I've had that muscle memory. I know exactly what to do. I know how to do it still. Another thing that I would like to do, because I graduated with my ASM, so then I applied and got in. I don't even think you really need to apply, but I got into the RN to BSN program at the University of New Mexico. It's actually cheaper than some of the other ones out there, so I'll be done with that in 1.5 years, it says. Most of my 400 level classes are done because I was pre-pharmacy before I started nursing, so a lot of my stuff's already done. I just have to do my nursing classes and they're all theory based, so it's gonna be really fun. And then just staying positive, because it's so easy to turn into a grump in nursing. Like, it's so easy. Some people are like, what's wrong, Josh? But I have resting bitch face. So I'm like, oh no, nothing's wrong with me. I'm just I don't like working. So just staying positive and like, I guess like be the change that you want to see. Like I said, I'm good to people, I'm good to the people I'm training. I want everyone to succeed and like just staying positive. Other than that, I mean, I don't know. I guess that's all I'm gonna say about that. But thanks for watching, guys. I hope this was a little bit enlightening for you guys about what it's been like for me being a nurse the past year. Because I'm really happy I did it. If you ever want to do it, but be wary. Nursing school is very tough. So thanks so much for watching, guys. Don't forget to comment if you have any questions. I'm happy to answer and get back to everybody. If you want to go ahead and thumbs up and then hit that bell to subscribe to me. Alright, well, I'm gonna stop talking now. I love you guys. Bye!